Welcome to True Health Tuesdays. Okay, today we're talking about Parkinson's disease. We're going to go over the psychotic medical definition, what it actually is, and how to correct it and prevent it. When you look at the Parkinson's Disease Foundation, these are supposed to be the definitive experts. Their definition, Parkinson's disease is a chronic and progressive movement disorder, meaning that symptoms continue and worsen over time. It involves malfunction and death of vital nerve cells in the brain called neurons. Some of these dying neurons produce dopamine, a chemical that sends messages to parts of the brain that control movement and coordination. As Parkinson's disease progresses, the amount of dopamine produced in the brain decreases, leaving a person unable to control movements normally. It's interesting, dying and death of neurons. Now, so shouldn't, after they make a statement like this, list an incredible amount of neurotoxins that we're exposed to? I would think so. Okay, so now, primary motor symptoms of Parkinson's: tremor of the hand, but also tremor of the jaw, the teeth, the legs, face, slow movement, rigidity, stiffness, postural instability. And in fact, you'll pretty much see, you're never going to see someone with Parkinson's standing like this. Their head is going to be massively forward. They're going to be stooped shoulders, mass face, and they're going to be movement, because movement actually triggers dopamine. So you can actually see Parkinson's damage, half a block away. Million Americans, over 10 million worldwide. But when you look at the frequency of this, more people with multiple sclerosis, muscular dystrophy, Lou Gehrig's disease, all combined. Okay, so this is incredibly popular. And keep thinking back. Okay, so this has to do with the nerve death, neurotoxins. Now, of course, according to the Parkinson's Disease Foundation, the cause is unknown. Unknown for nerves dying. Although there's presently no cure, there are treatment options such as medication and surgery to manage its symptoms. I don't see dietary changes. I don't see researching the neurotoxins. I don't see anything else. Do you see the missing parts of this? So let's go into it. What are the standard treatments, prescription medications, over-the-counter drugs, surgical treatments, and the Parkinson's pipeline? There's a pipeline where they don't really need to do a lot of testing on the drugs. They can get the drugs right to the people that are going to be experimented on. I'm sorry, is my sarcasm showing? So the drugs, levodopa, dopamine agonist, anticholinergics, MAO-B inhibitors, and COMT inhibitors. Now, when we look at this, let's look at the side effects. And this one is Sinemet, which is one of this. In short term, it showed very, very effective in controlling some of the shaking. Long term, it causes worsening of the tremors, restless muscle movement, high fever, stiff muscles, uneven heartbeats, seizures, convulsions, difficulty in urination, fluttering in your chest, confusion, hallucinations, anxiety, agitation, suicidal thoughts, heaviness, chest pain. So how do you know it's from Parkinson's or the side effect of the drugs? Let's look at the dopamine agonist. Okay, nausea, vomiting, feel like you might pass out. Dizziness, depression, and hallucinations again. Chest pain, heavy feeling, severe headaches, worsening of Parkinson's symptoms. Twitching and uncontrollable movements. Let's look at the other drugs, okay, the anticholinergic drugs. Heart fluttering in the chest, feeling weak, too weak to move, severe constipation. Again, twitching, uncontrollable movements, the eyes, face. How do you know if you're treating a drug and the symptoms of Parkinson's are getting better or worse? It just doesn't make any sense. MAO-B inhibitors, headache, confusion, problems with speech or balance, twitching, muscle movements. Surgical treatment, yeah, this is a good one. Okay, what they're going to do is put electrodes inside of the brain, put like a pacemaker thing underneath the chest, and they're going to use an MRI to actually target the area of the brain to pass some electrode in there. It's an impulse generator. Now, it provides an electrical impulse to part of the brain involved in motor function. They have a controller to turn the device on or off. Neat. Electrically controlled humans. See, dear, I'm not the only one that thought of it. Don't you wish? I wish you had a switch so I could turn you off sometimes. No. Okay, so the side effects of deep brain stimulus. Look at this. This is the surgery that they do for Parkinson's. Seizure, infection, headache, confusion, disoriented, cognitive decline, speech difficulties, hallucination, depression, strokes, abnormal or impaired movement. Weren't they trying to fix it with this? Okay, so we've just gone through the world of psychosis. Okay, this is the medical world. Okay, let's look at the actual causes. Now, it's called substantia nigra. You got this area called the midbrain. It's right at the top, and it literally is black substance. Now, the Parkinson's Disease Foundation, again, they're talking about dying neurons produce dopamine, a chemical that sends messages to part of the brain controlling movement. Now, substantia nigra is Latin for black substance because there's a lot of neuromelanin in it, in dopaminergic neurons. Now, these neurons consist of two parts, pars compacta and pars reticulata. Now, look at it, it just has like input and output signals. Now, the input signals supplies the striatum with dopamine. The output signal supplies the signals from the basal ganglia to other brain structures. So it's really, when you look at it, it's very centrally located in the brain at the bottom. Now, when you do a coronal section like this, you're actually going to see it, okay? And it's the most beautiful thing you ever saw. In fact, here, you can kind of see that the top of the brainstem there, and that's composed of the medulla, pons, and midbrain. At the top of it, that's where substantia nigra is. And it's the neatest thing because when you slice the brain off, you can actually see it. But it's right in the middle of the brain. Now, what I want you to picture is we've got the brain up there and the spinal cord comes down. The spine itself surrounds the bottom part of that midbrain. So any trauma can actually damage that area of the spinal cord. And we're going to see how spinal cord or head trauma is also a contributing factor. There's also impact or accident generated Parkinson's, such as like what Muhammad Ali suffered through. But what's interesting here, when we look at it, now here's 3 x-rays. We're looking at normal on the left, and we're looking at Parkinson's. And so what happens? That head is massively forward. You're not going to see someone with Parkinson's like this. Now I want to go back to this. Picture that brainstem. The brain itself, or the brainstem, which is part of the spinal cord, it's a long tubular brain. It doesn't stretch. So if you're pulling that head forward, you're literally stretching that brain, long tubular brain called the spinal cord. So when we see a distortion of the spine itself, and those are 2 patients with Parkinson's, and I got to tell you, 100% of the people with Parkinson's are going to have loss of curve in the neck and forward head carriage. It's tremendous when you see a consistent x-ray finding like that with a consistent diagnosis. Does that make sense? Okay, now here's a patient, 76 years old, before, and she had Parkinson's for 12 years. She went from, we're talking a cane to a walker to a wheelchair when I met her. Then we got her from a wheelchair to a walker to a cane. And that's her pre and post x-rays. You can see the curve coming back. But why would the curve coming back have an effect on how the body works? Well, we're going to see the studies on it. And here's another patient, again, before and after, 72-year-old. Now, he had leg tremors, okay, for Parkinson's. And it's the same thing. You can see massive forward head carriage on one. And even look at the balance. The balance, We're measuring the lateral malleolus, or the part of the ankle that your body should be balanced with. He was massively forward because with lack of stimulus up to the brain, you need to get more input into that brain. And so you're going to force it. It's kind of like when you look at somebody with autism, they're going to look down and up, so they're going to be looking a little odd at you to get more of that brain stimulus. Now it's interesting, now a couple of journals here, Journal of Manipulative and Physiologic Therapeutics, upper cervical chiropractic care, aided by cervical radiographs and thermal imaging, successful outcome for a patient with Parkinson's. Case studies suggest that chiropractic biophysics may also reduce the symptomatology by improving spinal alignment and posture. Okay, Annals of Vertebral Subluxation Research. Also, when you look at Annals of Subluxation Research, they call it the vertebral subluxation complex. And what this is, well, kinesiopathophysiology means there's a problem with the movement. Now, the way the body works is each segment of the spine is supposed to move correctly. If there's an alteration in movement from some type of trauma, and you're going to see consistently 9 out of 10 patients with Parkinson's had an incident of trauma before the onset, and we're talking within 10 years. So get a trauma that affects the nerves. Okay, that's called the neuropathophysiology. So first you have movement problems or kinesiopathophysiology. That leads to the nerve problems. That leads to the muscles tightening up, because the muscles that run down either side of the spine you don't have conscious control over. So then you get the muscle problem or the myopatophysiology. And it's interesting, treating both the kinesio or movement problem and the myo problem, components of the vertebral subluxation complex, allows the nervous system to function at its best ability given the neurologic state of the patient, allowing for a decrease in hand tremors, increasing range of motion, and reduction in the overall pain levels of the patient, result of the dysfunction occurring within the spine. So when we look at this, we have to look at how the brain works. And the brain functions like a battery, and it gets a charge from the normal position and motion of the vertebrae. So poor position causes poor motion, poor stimulation of the brain, and poor proprioception, or poor brain's awareness of the body. Now it's interesting, here's an article out of the Journal of Upper Cervical Chiropractic Research. Nervous system facilitation is an increase in afferent signals to the brain and spinal cord, and can occur following spinal injury. This signal amplification is sent from the articulating mechanoreceptors within the spine. I know what you're saying now. Why doesn't that son of a bitch speak English? No, this is really cool stuff. Okay, I know. How many languages do you speak? German, Brazilian? Okay, yeah, Portuguese. Okay, so let me translate this into English, okay? Nervous system facilitation, an increase in afferent signals to the brain and spinal cord. Has anyone in here ever had their arm fall asleep? Yeah. So what's it feel like when it comes back? It's all like pins and needly, right? That's because when you compromise the nerve, it increases its sensitivity. That's what they're saying here, okay? So this means any spinal injury, because your brain always needs that afferentation or sensory input into the brain. And so if you have an alteration of that, it can have a hypersensitization or more information going up to the brain. Now, they're talking about the articular mechanoreceptors. Now, there's joint mechanoreceptors around each aspect of the spine. And what these are, the spinal segments have these little tiny articulates or facet joints, and they have joint mechanical receptors in there, or sensors, but also the intrinsic muscles. One of the things this journal article fails to mention is the intrinsic muscles of the spine, these little tiny muscles inside of the spine. They have 4 times the muscle spindle receptors, and these are more sensors going up to the brain to let the body know, or the brain know, what the body is doing. Okay, so we have a tremendous amount of information up. This is why an alteration in movement or trauma radically alters the information going up the spine or up to the brain. So when we look at this, now hyperafferent activation of the sympathetic vasomotor centers occur through the central nervous system. Facilitation can lead to subclinical ischemia, causing neurons in the brain to hibernate. Okay, remember how the Disease Foundation, the Parkinson's, they're talking about death of the neurons? It's interesting. Do you have dead cells in your body? How does your body handle dead cells? Has anyone ever seen your body eliminate dead cells? Can I borrow your cane to give someone a bruise? No, I'm not going to hit someone. That's so rude. Gosh, I was just kidding. No, well, think of this, okay? If you go in there, bam, you get a bruise. What is that? That's dead cells. You've got macrophages, or big eater cells, that go in there and that chew up dead cells. So why would you have dead cells in the middle of the brain? Okay, it just doesn't make sense, does it? And how long are these dead cells there? What happens to them? What happens if the cells just get necrotic, they die, they fester? Doesn't it make more sense, according to the Journal of Upper Cervical Chiropractic Research, that they go into hibernation, or they're like a subclinical ischemia, where they're not getting enough nutrients to initiate what's called an action potential, so they can do their job. Now, this is the way nerves are. Nerves actually are either on or off. There's not like a sensory input. It's like right now, if I went like this, could you feel that?
No.
If I went, say yes. You're further than a birthday cake, okay? Give me a birthday cake. Okay, you felt it. Thank you, dear God, that girl loves me. Okay, but you know what I mean is that you can have a stimulation, but it'd be not enough for the nerve to send that action potential up. And what they're talking about is that the sympathetic vasomotor, so you've got this autonomic nervous system composed of two parts. One part is parasympathetic, called the rest, digest, and repair. The other is sympathetic. Now, the sympathetic nerve supply, when you're under fight or flight, when you're in trouble, the vasomotor, or blood vessels, the controlling aspect of the blood vessels that can either dilate or constrict the blood vessels, it sends blood to the arms and legs so you can run away from danger under sympathetic or fight or flight activity. Okay, does that make sense? Where does the blood come from? If it's going to the arms and legs to get you away from danger, where is it coming from? The organ systems. Okay, so what they're talking about is that under a stress circumstance, physical, chemical, or emotional, that this can activate the sympathetic, causing a decreased blood supply or a little bit of ischemic event inside of the brain, causing the neurons not to die, but to not be as active. Which makes sense, because when we're talking about 90 days, we're taking people that can't really walk, can't function or shaken, to where they can start to tie their shoes and they can stand up. We're not generating brand new neurons, not in that short time frame. Okay, so what else is happening? We're going to get into this when we talk about multiple sclerosis next week. But so how are people recovering? Could it be that we're changing the sensory input into the brain, and that we're also allowing the blood supply to return to the brain? That would make sense. So now, removal of this nervous system facilitation should restore blood flow to the hibernating neurons in the substantia nigra, allowing them to resume their role in dopamine production, thus reducing Parkinson's symptoms, signs. That makes sense. So now, if we can adjust the vertebrae, take care of the movement pathology, take care of the nervous system or the neuropathology, take care of the muscle pathology, and have a positive outcome like the research shows, what other things could we do to help with movement and oxygen to the brain? Exercise, good idea. Oh, let's look at the Journal of Clinical Neurology. Aerobic physical exercise activates the release of neurotrophic factors, that's nerve stuff that grows, promotes angiogenesis, which means blood vessels start to grow, facilitating neurogenesis, which means nerves start to grow, and synaptogenesis, this means the connection that the nerves have start to grow, in which improve memory and cognitive functions. Exercise limits the alterations in dopaminergic neurons in the substantia nigra, contributing to optimal function of the basal ganglia, improved motor commands and control of the adaptive mechanisms involving dopamine and glutamate neurotransmission. Oh my God. So exercise or correct movement changes the proprioception or afferentation sensory input to the brain, changes oxygen, and this changes brain function. Call the newspapers. The Parkinson's Disease Foundation doesn't know this. Chiropractic adjustments and movement actually helps brain function. Okay, now exercise and brain plasticity. Exercise increases structures in the brain such as the hippocampus, improves memory. Why? Because aerobic exercise actually can reverse problems with the hippocampus. Increases oxygen flow to the brain, releases accumulated toxins, increased blood flow, increases nutrients for brain cells. The journal Cell. Let's look at the microflora, or the gut biome. The intestinal microbiota influence neurodevelopment, modulate behavior, and contribute to neurologic disorders. Good God, does the Parkinson's Foundation, are they aware of this? Please have somebody over there send them these journals. This is going to radically alter their therapy. Instead of giving toxic drugs that cause the symptoms, we can actually reverse this. Wow! Oh, you're going to call them? Good job. Okay. These findings reveal that the gut bacteria regulate movement disorders. Oh my God! And suggest that alterations in the human microbiome represent a risk factor for Parkinson's disease. Does this mean that the neurotoxins that we have in the food, such as the glyphosates, the food preservatives, the genetically modified foods, the hormones that are laid in the dairy products, all of those that can alter hormone and microgut flora in the gut, that those could be contributing to the neurologic diseases that we have? Wow, amazing. So look at this, Pharmacology and Therapeutics Journal. The gut microbiome comprises the collective genome of trillions of microorganisms residing in our gastrointestinal ecosystem. I love that term. I mean, because like if you look at say, a rainforest, that's an ecosystem, right? Been around for several thousand years. What can we do to make the rainforest ecosystem work better? What do you mean nothing? You can't put like fertilizer in there? No, that wouldn't work. It already has it. What if we bring more animals? No, that wouldn't work. They're already in harmony. You understand, an ecosystem has its own harmony, just like our ecosystem of our gut. And the interaction between the host and its gut microbiome is a complex relationship whose manipulation could prove critical to preventing or treating not only various gut disorders like IBS, ulcerative colitis, also central nervous system disorders such as Alzheimer's and Parkinson's. My God, these are both at near epidemic proportion now. And they're talking about the gut microbiome, the gut flora, the gut bacteria. So does this mean that every time there's an antibiotic-laden bread or glyphosates in the food, that this can be negatively affecting the nervous system and the brain function? Wow. Yeah, we've got one of our patients who really wasn't listening. Sweet gal, she just got a hip replacement that she didn't need a hip replacement for. Okay. I mean, it was just beautiful, but the hip hurt and she just listened to the surgeon, wanted to get it done. She's taken about 7 different medications right now. And she sent her son off to the market, and her son comes over and talks to me and says, you know, she sent me to Trader Joe's and I got a bunch of microwave foods for her, which, can you microwave food and have it come out healthy? No, it's destroying her gut flora. I mean, it's like crazy. And this is going to negatively affect brain function. So what do we do to reverse Parkinson's? What do we do to maintain brain health? We restore the gut flora. That's primary. Okay, organic, plant-based foods, seasonal, fermented foods, probiotics, juiced vegetables, raw dairy, omega-6 reduce omega-6 and increase omega-3 animal fats. Ketogenic diet, again, Journal of Molecular and Neuroscience. These are not Hobunk journals. This is in the literature. A ketogenic diet is a high-fat, low-protein, low-carbohydrate. It is reported that ketogenic diet can provide the neuroprotection. Remember, we're talking about death of the neurons? Neuroprotection for the neurodegenerative diseases such as Alzheimer's, Parkinson's, and ALS. Wow. We conclude that the ketogenic diet was neuroprotective and anti-inflammatory against neurotoxicity. Again, most important nutrient, animal fat-based omega-3s. But they got to be from healthy fish, anchovy, mackerel, sardine. I mean, phenomenal. Coenzyme Q, according to the Archives of Neurology, slows the progressive deterioration of function in Parkinson's disease. Journal of Neurochemistry. These results provide further evidence that the administration of coenzyme Q is a promising therapeutic strategy for the treatment of Parkinson's. Good God, what's the side effect of coenzyme Q? Where can we get coenzyme Q? Oh, gee whiz, grass-fed beef, mackerel, sardine, herring. Oh, okay, that makes sense. Free-range chicken. Pistachios, broccoli, cauliflower, oranges, strawberries better be organic because they're extremely pesticide laden. Cage-free eggs. Now let's look at B6, vitamin B6. Now, when you look at this, okay, and they talk about, they're not quite sure. They know B6 helps, but there's a couple of mechanisms behind it. The conclusion, dietary vitamin B6 may decrease the risk of Parkinson's, probably through mechanisms unrelated to homocysteine metabolism. Journal of Neurology. Wow, where do we get B6? Oh my gosh, bananas, salmon, of course not farm raised, spinach, sweet potatoes, hazelnuts, turkey. Could this be that a healthy diet and healthy nutrition gives a healthy brain? Cannabinoids. Every hippie from my generation is doing hamstrings now. I told you, dude, plant-based medicine, it's the way. Yeah, okay, cool. Okay, but you know, I mean, you got to figure they're doing this stuff. The studies in Israel, studies in England. I mean, if anyone hasn't seen Run from the Cure by Canadians, you guys rock. Okay, it's brilliant. They talk about essential oils. Okay, wiping out skin cancer, and luckily it's been legal in California medically. You know, for skin cancer, we've been recommending it to so many patients. But look at this. Cannabinoids have been reported to provide neuroprotection in the acute and chronic neurodegeneration. That means if you have a nerve that's deteriorating, this protects it. And we're talking cannabinoid and agonist to modulate glial functions produced by the combination of both mechanisms. Glial is like the glue of the brain that holds it together. If you've ever seen an Alzheimer's brain, it looks like a moth-eaten sweater. So this is going to protect that. More articles, Frontiers in Pharmacology. CBD, it's the non-psychometric compound from cannabis sativa that presents antipsychotic, antilytic, anti-inflammatory, and again, neuroprotective effects. Use of this compound in pharmacotherapy of Parkinson's disease and tardive dyskinesia. I mean, amazing. Non-toxic. Oh, damn it, it's non-patentable too. Well, maybe we can synthesize it, put a drug on it, and the pharmaceutical industry will have to make some money. But, you know, if not, it's non-patentable. It's almost legal in some states. Again, toxicology in vitro. CBD is a non-psychoactive constituent of cannabis sativa with the potential to treat neurodegenerative diseases. Its neuroprotection has been mainly associated with anti-inflammatory and antioxidants. I mean, it's like, my God, all of these journal articles are saying, look, these things protect the neurons. What does the Parkinson's Foundation say? Neurons are dying. Okay. Well, okay, good. What do we do to protect them? How about adding a little turmeric? Commonly used spice throughout the world: anti-inflammatory, antimicrobial, antioxidant, and anti-neoplastic properties. Curcumin may be effective in preventing and slowing the progression of Parkinson's disease. Journal of Toxicology and Pathology. These data suggest that curcumin has potential therapeutic value for neurodegenerative diseases involving the GSH depletion mediated oxidative stress. That's Free Radical Biology and Medicine. You got to read that article. That one's cool. Several studies in different experimental models of Parkinson's disease strongly support the clinical application of curcumin in Parkinson's disease. Current pharmaceutical design. I mean, it's non-toxic. It's good for you, and it tastes good. Does anyone like the taste of this? Yeah. You got to try it in raw milk. It's out of this world. Resveratrol, found in red wine and grapes, antioxidant, anti-cancer, and anti-inflammatories. Resveratrol exerts neuroprotection against LPS-induced dopaminergic neurodegeneration, and NADPH oxidase may be a major player in resveratrol-mediated neuroprotection. Again, you're looking at this neuroprotection, and honestly, I mean, red wine is not just for breakfast. It's an all-day meal. Always. What? Aren't there any Italians? Come on, okay. Indeed, there's now a consistent body of in vitro and in vivo data. Neuroprotective effects of red wine. Not to really rain on anyone's parade, but grape juice has the same kind of thing in there. So let's say you're, a type of culture that can't drink wine. Okay, this one here is cool. Grape juice works too. But again, look at this. Underlying key mechanisms feature in both Alzheimer's disease and Parkinson's. My God, it can't be that simple. Do you mean that all you have to do is get the nervous system checked? Okay, and what this is make sure that you have appropriate sensory input in, appropriate afferentation into the brain. So you got to get your nervous system checked. What does that involve? Heart rate variability, rolling thermoscan, surface electromyography, digital x-rays, stress x-rays. Thorough, and check the entire structure, not just the area of concern, which is absolutely foolish. You've got to get regular exercise. Why? Oxygen is good for the brain. Newsflash. Proper nutrition. This means if man makes it, you don't freaking eat it. But the neuroprotective effects against spices, curcumin. We're not even talking about vasodilators like spicy foods, peppers, vitamin C. Look at the stuff that protects. We got it on the sheet here. Broccoli, cauliflower. Saute the cauliflower a little bit. It's delicious. Bananas, spinach, sweet potatoes. This is good stuff. Deep sleep. If you're not getting deep sleep, you've got to check our new thing on Udemy, which is a teaching site. That we're going to have a series of lectures on there. We're talking about 5 hours, of filming on this in, 15 or 20 parts? 15. 15 parts. The first educational video we have on is sleep. And do you know how many people have problems with sleep? 100% of the people with chronic degenerative and neurologic diseases. And then I'll go through and I'll explain the 5 different steps for it. And you know what people say? Well, yeah, I'm going to start that later. Really? Why? Do it tonight. Okay? Sleep restrictive therapy, you got to do it. And prayer and meditation. How do you reprogram your brain? Remember, emotions are chemicals secreted by how the brain is wired. And you can reprogram your subconscious by doing repetitive action. Prayer and meditation. If you do focused meditation and focused prayer, by God, you can rewire the brain. Plus, it's cool to connect with the higher source. Okay, now for trolls. Reference. Yeah. Any questions? Yes, ma'am.
I'm just wondering why the neck curve would present itself as Parkinson's in one person and something different in another person.
Oh, perfect. What are their microbiomes like? What are their physical, chemical, or emotional stress load? That's actually a really good question because we get that all the time. You know, my buddy, he eats, fast food every day and smokes cigarettes, and his meth habit is half as bad as mine. What's the deal? How come he's healthy and I'm sick? Look at the three stressors: the physical, chemical, and emotional stress load. Okay, and your body can reach a threshold. It's like the Chinese torture of a death of 1,000 cuts. You can survive 20 cuts. You can survive 50. Eventually, you reach the threshold. So do you have a crappy microgut flora? Two people with 100% loss of curve and 3 inches of forward head carriage. One person has a healthy microbiome, one person doesn't. One person sleeps good, the other one doesn't. One person has high stress lifestyle perception, the other one has a low stress lifestyle perception. Understand I said perception? So you could be a fire-eating, knife-juggling air traffic controller, okay, and be mellow. You can be a post office worker that is, not a high-stress job, but, really realize that could be a high-stress environment because you're not feeling your self-worth. So it's based on your perception, not on what's actually happening to you.